A very good morning to all. So today we would be seeing the preparatory questions or the most expected questions for the Norcet examinations. That is the main exam for Aims. So the first question is, what are the symptoms of digoxin toxicity? So the options are decreased urine output, bradycardia, severe hyponatremia, tingling. The right answer is decreased urine output. So for this you need to know what is the action of digoxin. So digoxin is a cardiac glycoside that is used for the treatment of moderate heart failure, and what this digoxin does is it reduces the workload of heart, it reduces the heart rate as well. So it is a positive inotropic and negative chronotropic drug. So and along with that, this drug also has the effect of reducing the urine output. So along with digoxin, always a laxative will be provided. So these are the techniques how digoxin has to be administered. So rapid digitalization with loading dose of body can store 8 to 12 mcg per kg generally. The initial dose is 500 to 73 micrograms usually produces detectable effect. So the next question is, what is the best site for DPT immunization for infants? So we know that what DPT is. So it is for diphtheria, pertussis and tetanus. So where is the right position to give this? So anterior lateral thigh, vastus lateralis, dorsogluteal, both A and B. The right answer is vastus lateralis, B. So we know what is DPT. So why we have to give it in vastus lateralis is, so it avoids the risk of sciatic nerve damage. Number 2 is it has larger muscle mass in children, and the deltoid is not sufficient for this bulky doses, and it avoids the thicker layer of subcutaneous fat in the thighs. The next question is, a neuromuscular blocking agent is administered to client before ECT therapy. The nurse should carefully observe the client for dash. So you all know what is ECT, right? So it is electroconvulsive therapy. So during electroconvulsive therapy in the modified ECT, we have to administer neuromuscular blocking agent. So when this is given, example vecuronium or rocuronium, when it is given, what has to be monitored? So the answer is respiratory difficulties. So what happens during the neuromuscular blockage is the muscles of the chest also start to relax, and what happens is because of this there is respiratory difficulties. Neuromuscular blockers such as succinylcholine produce respiratory depression because it inhibits the contractions of respiratory muscles. So in order for this we need to know what ECT is, how ECT is given, and how much dose of medicines are given during ECT. So the next question is, enzyme test for myocardial infarction, that is the most important enzyme test for myocardial infarction is dash. So the options are renin, insulin, troponin and butylated hydroxytoluene. The right answer is troponin. And why we'll see here. So anytime when myocardial infarction occurs, any damage to the muscle tissue occurs, there are enzymes that are released by the body, especially during ischemia and damage to the heart muscles. Cardiac enzymes are complex substances that are found in the tissues that speed up the biochemical reactions of the body. Damage to the tissue causes release of enzymes in the cells. So there are various enzymes that are released. So there are some enzymes like myoglobulin, CKMB, creatine kinase, troponin, AST and LDH. All these have a different range. So for example, myoglobin, the initial risk is less than 2 hours and the peak is 6 to 9 hours. So it comes back to normal in 1 day. So second day if you test, you will not be able to find myoglobulin on that day. So the next our answer is troponin. So troponin is, the peak is 14 to 24 hours and it will be there in the blood for 3 to 5 days. So you can identify if there has been a myocardial infarction if you do the testing within 3 to 5 days. The next one is antidote for heparin is dash. Vitamin K, protamine sulfate, aminocaproic acid, aminodrone. So the right answer is, the only heparin antidote is protamine sulfate. So this protamine sulfate, it is an you know what is heparin? Heparin is an anticoagulant blood thinner that prevents the blood clots. So what happens here is, when we take it in excess quantity, when it is given accidentally or it is ingested intentionally, what happens is heparin starts acting by preventing blood clots and it thins the blood also. So the antidote for this is protamine sulfate. So what is protamine sulfate? This protamine sulfate is an arginine rich protein derived from salmon sperm. So what happens here is, when we give this, there are effects of heparin gets reversed. So how much we have to give is 1 mg of protamine per 100 units of heparin. So if 100 mg of heparin is ingested or 100 mg of heparin is given IV, so we have to give 1 mg of protamine. So we need to know what happens when heparin is given more. When heparin is given more, there is increased risk of bleeding everywhere in the body. Tarry stools will be there, warm skins, chest pain, shortness of breath, unusual bleeding, nausea, vomiting, tiredness, and all this will be there when heparin is increased. The next question is, persecutory delusion is more common in which of these diseases? Number 1, anxiety. Number 2, paranoid schizophrenia. Number 3, phobia and adjustment disorder. So the answer is paranoid schizophrenia. So we all know what is schizophrenia. It is splitting of mind or disorganized thinking. So especially in paranoid schizophrenia, what happens is, paranoid, the term itself means that they will have increased delusions and doubts on things that are happening around them, especially that they are being harmed. So what is persecutory delusion? Persecutory delusion is somebody feels that they are being harmed by others, or they are being plotted, or somebody is trying to harm them in their environment or surroundings. So the next question is, posterior cerebral artery is a branch of dash. So where is posterior cerebral artery is the question. Vertebral artery, basilar artery, posterior cerebral artery, posterior choroidal artery. The answer is basilar artery. So where is this basilar artery? It is a part of the brain circulatory system. So when you see in this diagram, you will be able to locate where it is. So here, this is the posterior cerebral artery. It is divided from the posterior communicating artery. It comes here and it divides from the basilar artery. So this is the basilar artery that goes down from the vertebral artery, and it divides in the upper place as two things: posterior communicating artery and posterior cerebral artery. The next question is, Kernig's sign is a striking feature of dash. So what is this Kernig's sign and what is this test used for? So Kernig's sign is a test for dash. So the options are meningitis, nephritis, neuritis and dendritis. The right answer is meningitis. So we know what is meningitis. It is the inflammation of the meninges. So during this, what happens is there is increased rigidity and stiffness, headache and fever all seen in the body. So especially this sign can be used as a test. So how we are going to use it? So it is a physical maneuver used for evaluating suspected meningitis. So the method is individual lying on back with hip and knee flexed at 90 degrees. Resistance pain in lower back, inability to extend is a positive Kernig's sign. So what happens here is you're going to put the patient in lying position, flat, take their knees, flex the knees and extend. So when this is done, if they have resistance or pain, it means it is a positive Kernig's sign and they have meningitis. Next question is, identify the following image of IV cannula. What is the size of it? So this is a pink colored IV cannula. So what is the size of this is the question. It is an image based question. So the options are 18 gauge, 24, 16 and 20. The right answer is it is 20 gauge. So what are the other sizes where we have to use it? All these things have to be kept in mind. So orange is 14, gray 16, white 17, green 18, pink 20, blue 22 and so on. The next question is, a manic patient is admitted to psychiatric ward and is prescribed lithium. Which electrolyte should be monitored? The options are chloride, potassium, sodium, none of the above. The right answer is sodium. So lithium is the most important mood stabilizer that is administered to patients who have mania or bipolar disorders. So during this, what has to be monitored is sodium, because whenever there is a sodium depletion in the body, when sodium level is decreased in the body, it leads to an increase in the absorption of lithium, whereby the increased lithium rate absorption in the body increases, and it increases the level of blood, which may lead to a condition called as lithium toxicity, which is very fatal. So to prevent lithium toxicity, sodium has to be monitored regularly during lithium administration. And if the patient has dehydration like diarrhea and etc., they have to be replaced with sodium as early as possible, otherwise the lithium level will increase in the body. So sodium depletion enhances the renal tubular reabsorption of lithium, thus leading to potentially toxic serum levels. The last question is, Deficiency of serotonin causes dash. Myocardial infarction, anemia, depression, none of the above. The right answer is depression. So serotonin is an important neurotransmitter that when goes to lower levels can lead to condition called as depression. So it helps to regulate your mood naturally. When your serotonin level happier, calmer, more focused, and less anxious, and also emotionally stable. A 2000 study found that people with depression often had lower level of serotonin. So with this we end up. Thank you.
Hi friends, I hope the video was useful. If you would have liked the video, I request you to subscribe for the channel and like, and also press the notification button so that my effort reaches you on time, all the time.